Hi, my name is Lisa, and I am the founder of Rest Ministries, a Christian organization that serves the chronically ill. I am also the founder, you might be interested to know, of National Invisible Chronic Illness Awareness Week that happens every year annually in September. And we have an entire week of kind of a virtual conference with about 20 speakers. You can find all kinds of information about that at invisibleillnessweek.com, along with the last 2 years completely archived from Blog Talk Radio from the programs there. So you might want to check that out. I'm doing a short series of videos on my recent joint replacements on my left hand from rheumatoid arthritis. And the next, this one that I'm going to show you is what I called my torture device. The original splint looks like this, and I had it on in a previous video and explained a little bit about it. It's called an outrigger splint, and it's got a lot of little dangles and rubber bands and everything, but it actually works really well, and it holds your fingers in place. Now, for a lot of people, they do actually form an outrigger splint where they pop something off and turn it around and put it this way. The goal with my hand, as you can see right now, I will try to bend my fingers. These are the 4 joints here replaced. And I've got a crooked joint in my ring finger, and so that's kind of one of the reasons it's not wanting to go down. But to try to bend it here, I had about, in these joints that are new, about a 20% angle, and they were hoping for about 45%. Now, if you can take your good hand, which this is not my good hand, this is a bad one too, but you know, you're trying to get this movement out of it. My husband actually said I could do some really cool shadow puppets with this, don't you think? So anyways, the goal is to bring these fingers down, and you're doing the exercises when you're in the splint where you're pushing them down as far as they will go and holding it, pushing it down as far as it'll go and holding it. And you're doing that every day. I have to say I was religious about doing my exercises, because that is really about, you know, 80 to 90% of the impact of having a new hand or a better hand is going to be from the exercises you do with your therapy. The surgeons are wonderful. They put the joints in there, but if you don't do your exercises, nothing good is going to come from it, and your therapist will know. So don't make them upset, because you need to go in there with a positive attitude and do all your exercises, because they can tell. So my therapist was very kind. I had my mother here helping me, but she was leaving. She had to go back home, and my husband was working during the day, and I didn't have anyone that could actually take this part out and pop it underneath for me, because that takes some physical strength as well, especially with one hand. So she made me this splint. This is the one I called my torture device. The first time she put it on me, I thought, oh my goodness, there is no way. But you learn to do things that you never thought you could do. And what I would do is kind of sit down at my laptop on my little table in front of the TV and try to keep, like, just do something silly with one hand with the mouse. I'd get on Facebook or do something I could do just to kind of distract myself. And you start out at 20 minutes or so, and the therapist said you basically start out at 20 minutes and work your way up until maybe there's tears in your eyes. Okay. All right, that sounds fun. So this one has a piece of metal down here, and then the goal is to bring your fingers down. So if I can get them in here. This is Velcro on these and rubber bands. Good old rubber bands. Make sure that you, when you're doing your splints like this, don't necessarily mimic me, because every person is different and every hand is different. So be sure to talk to your own physical therapist about where things like this should go on your fingers. I know with my hand and its deformities and its surgery exactly where to put these, where they're in relation to my joints, but it will be different for you very likely. So make sure to ask your therapist. So it's just good old rubber bands on a piece of metal, and it's like this. And it basically, right now, there's quite a bit of tension. I've been wearing this occasionally. They told me I could stop wearing it if I wanted, or I could give it another week and see if I could get any more out of there. So I worked my way up to about 2 hours, and then of course they tighten it. Then you work your way up to 2 hours again, then they tighten it. I got up to now I can wear this about 3 hours. I wasn't able to drive even as I was still wearing this, so I literally would stick this on, someone would drop my son off from school, and I'd have it on. The taxi would come. I learned in my little town there is one taxi company with one driver. To call the taxi, they'd come pick us up. I'd take my son to karate. I'd wear it the whole time to karate. When I got home, take it off. So I kind of worked my way up to 3 hours.
Learning how to do things one-handed. You don't have a whole lot you can do because you've got this thing, but you can grab something, not really a paper clip, but their fingers are out there. So you're not really able to do much of anything, and you just have to enjoy that moment. Sit and have a cup of coffee, turn on a TV show, your favorite movie, get up and dance to your music if you want, whatever, but find something to distract you, because I would find as soon as I stuck this on, it would hurt so bad. And if I literally was just going to go, you know, lay down for a minute and try to read or something, it wasn't enough to distract me from the pain, and it would just start to hurt. You know, the first 20 minutes would be okay, and then the next hour would get tough. And by that hour, between hour 2 and 3, I was a little bit grumpy around. If someone was asking me for something to eat or to play Indiana Jones, I was not in the happiest mood at the moment. So I have to say there is a certain amount of grace you need to give yourself, and also you know, keep an eye on your attitude because it does affect your entire family. So this is what I have been wearing up until recently. This last week I've stuck it on a few days. The therapist basically said, I know it's hard to find 3 hours every day to wear it, but if you can, it might help. It's up to you. I'm kind of in the zone right now. I've had surgery about 12 weeks ago. So there's still room left to get a little more movement out of these joints, and there won't be room much longer. They will have tightened up enough. I have to say, overall, I was discouraged, and so was a therapist, because even after building myself up to 3 hours a day and all of this tension, you feel like you're pushing those joints so far. I gained only 5% on a couple fingers and no percentage on others, but that's okay, you know, because if I hadn't done it, I would have always wondered and regretted that choice and wondered if I could have made it better. So we're going to move on now to the next video, and I will show you what I have now. Thanks.